Entering your 60s is a significant milestone, and maintaining your health becomes even more important. Regular screening tests can help detect potential health issues early, often before symptoms appear. In this video, we'll walk you through the essential screening tests recommended for people in their 60s. By staying proactive and informed, you can take steps to preserve your well-being and enjoy a healthier, more active life. Let's explore which screenings are most important and why they matter at this stage of life. Screening tests are designed to catch diseases early, often before you notice any symptoms. Early detection can make treatments more effective and improve outcomes. In your 60s, your risk for certain conditions increases, making regular screenings even more crucial. These tests can help identify issues like cancer, heart disease, diabetes, and osteoporosis, among others. By understanding the importance of screening, you empower yourself to make informed decisions about your health and longevity. An annual physical exam is the cornerstone of preventive healthcare in your 60s. During this checkup, your doctor will review your medical history, assess your vital signs, and perform a physical examination. This visit is an opportunity to discuss any new symptoms, review medications, and update vaccinations. Your doctor may also recommend additional screenings based on your personal and family health history. Regular physical exams help monitor your overall health and catch potential issues early. High blood pressure, or hypertension, is a common concern as we age. Regular blood pressure checks are essential, as hypertension often has no symptoms but can lead to serious complications like heart attack or stroke. Your doctor will measure your blood pressure at every visit and may recommend home monitoring if you're at risk. Managing blood pressure through lifestyle changes and medication, if needed, can significantly reduce your risk of cardiovascular disease. Cholesterol levels tend to rise with age, increasing the risk of heart disease and stroke. A cholesterol test, often called a lipid panel, measures your total cholesterol, LDL, bad cholesterol, HDL, good cholesterol, and triglycerides. Your doctor will recommend how often you need this test based on your risk factors. Keeping cholesterol in check through diet, exercise, and medication can help protect your heart health as you age. Type 2 diabetes becomes more common with age, and many people may not realize they have it. Screening for diabetes typically involves a fasting blood sugar test or an A1C test, which measures your average blood sugar over several months. Early detection allows for better management and can prevent complications like nerve damage, kidney disease, and vision problems. Your doctor will advise how often you should be screened based on your risk profile. Colorectal cancer risk increases with age, making screening vital in your 60s. There are several screening options, including colonoscopy, stool tests, and sigmoidoscopy. Your doctor will recommend the best method and frequency based on your personal and family history. Early detection of polyps or cancer can lead to more effective treatment and better outcomes. Don't skip this important screening, even if you feel healthy. For women in their 60s, regular mammograms remain a key tool for early detection of breast cancer. The frequency of screening may vary based on your risk factors and previous results, but most guidelines recommend a mammogram every 1 to 2 years. Early detection through screening can lead to more treatment options and a better prognosis. Discuss your personal risk and screening schedule with your healthcare provider. For men, prostate cancer screening is an important consideration in your 60s. Screening may include a prostate-specific antigen, PSA blood test, and sometimes a digital rectal exam. The decision to screen is personal and should be based on your risk factors and a discussion with your doctor. Early detection can help identify cancer at a more treatable stage, but it's important to weigh the benefits and risks of screening. If you have a history of smoking or other risk factors, your doctor may recommend a low-dose CT scan to screen for lung cancer. This test can detect lung cancer at an early stage, when treatment is more likely to be successful. Not everyone needs this screening, so it's important to discuss your individual risk with your healthcare provider. Early detection can make a significant difference in outcomes for lung cancer. Osteoporosis becomes more common with age, especially in women. A bone density test, or DEXA scan, measures the strength of your bones and helps assess your risk for fractures. Your doctor may recommend this test if you have risk factors such as a family history of osteoporosis, previous fractures, or certain medications. Early detection allows for interventions that can help maintain bone health and prevent fractures. Vision changes are common in your 60s, and regular eye exams are important for detecting conditions like glaucoma, cataracts, and macular degeneration. Early detection and treatment can help preserve your vision and quality of life. Your eye doctor will recommend how often you need screening based on your eye health and risk factors. Don't wait for symptoms. Routine eye exams are key to maintaining good vision. Hearing loss can develop gradually as we age, often going unnoticed. Regular hearing screenings help identify changes early, allowing for timely intervention. Untreated hearing loss can affect communication, social interaction, and even cognitive health. Your doctor may recommend a hearing test every few years, or more often if you notice changes. Addressing hearing issues early can improve your quality of life and keep you connected. Skin cancer risk increases with age and sun exposure. A skin exam by your doctor or dermatologist can help detect suspicious moles or lesions early. Self-exams are also important. Look for changes in size, shape, or color of moles. Early detection of skin cancer, including melanoma, can lead to more effective treatment. Protect your skin and stay vigilant with regular screenings. Vaccinations remain important in your soixante. Your doctor will review your immunization status and may recommend vaccines such as the flu shot, shingles vaccine, pneumococcal vaccine, and COVID-19 boosters. Staying up to date with immunizations helps protect you from serious illnesses and complications. Discuss your vaccine needs at your annual checkup to ensure you're fully protected. Thyroid problems, such as hypothyroidism, become more common with age. A simple blood test can check your thyroid hormone levels. Symptoms of thyroid dysfunction can be subtle, including fatigue, weight changes, or mood shifts. Regular screening helps detect issues early, allowing for effective management with medication if needed. Talk to your doctor about whether you need thyroid testing based on your symptoms and risk factors. Men aged 65 to 75 who have ever smoked should consider screening for abdominal aortic aneurysm, AAA, with an ultrasound. This condition can be life-threatening if undetected, but screening is quick and painless. Early detection allows for monitoring or treatment before complications arise. If you're in this risk group, talk to your doctor about whether AAA screening is right for you. Oral health is closely linked to overall health, especially as you age. Regular dental checkups help prevent gum disease, tooth loss, and detect oral cancers early. Your dentist will clean your teeth, check for cavities, and screen for any abnormalities. Good oral hygiene and routine dental visits contribute to better health and quality of life in your 60s and beyond. Mental health is just as important as physical health. Depression can affect anyone, and older adults may be at increased risk due to life changes or health issues. Screening for depression involves simple questionnaires and conversations with your healthcare provider. Early identification and treatment can improve mood, energy, and overall well-being. Don't hesitate to discuss your mental health at your checkups. Cognitive changes can occur with aging, and early detection of memory or thinking problems is important. Cognitive screening tests assess memory, attention, and problem-solving skills. These tests can help identify early signs of dementia or other conditions, allowing for timely intervention and planning. If you or your loved ones notice changes in memory or thinking, discuss cognitive screening with your doctor. The CDC recommends that all adults born between 1,945 and 1,965 be screened for hepatitis C at least once. This blood test can detect the virus, which often causes no symptoms until liver damage occurs. Early detection allows for effective treatment and can prevent serious complications like liver, cirrhosis, or cancer. Ask your doctor if you need hepatitis C screening based on your age and risk factors. Glaucoma is a leading cause of blindness, especially in older adults. Regular eye exams include screening for glaucoma, which measures eye pressure and examines the optic nerve. Early detection is key, as glaucoma often has no symptoms until vision loss occurs. Treatment can slow or prevent further vision loss, so routine screening is essential for protecting your eyesight. Age-related macular degeneration, AMD, is a common cause of vision loss in people over 60. Regular eye exams can detect early signs of AMD, allowing for interventions that may slow progression. Symptoms include blurred or distorted central vision. Early detection and treatment can help preserve vision and maintain independence. Discuss your risk and screening schedule with your eye doctor. Cataracts are a natural part of aging and can cloud your vision over time. Regular eye exams will monitor for cataracts and determine when treatment, such as surgery, may be needed. Early evaluation helps ensure timely intervention, which can restore clear vision and improve quality of life. If you notice changes in your vision, schedule an eye exam promptly. Peripheral artery disease, PAD, is more common with age and can cause leg pain or difficulty walking. Screening may involve a simple test called the ankle brachial index, which compares blood pressure in your ankle and arm. Early detection allows for lifestyle changes and treatment to improve circulation and reduce the risk of complications. Talk to your doctor if you have risk factors for PAD. Kidney function can decline with age, and chronic kidney disease often has no symptoms in early stages. Blood and urine tests can assess how well your kidneys are working. Early detection allows for interventions to slow progression and prevent complications. Your doctor may recommend regular kidney function tests, especially if you have diabetes, high blood pressure, or other risk factors. Liver health is vital, especially as you age. Liver function tests are blood tests that measure enzymes and proteins to assess how well your liver is working. These tests can detect liver disease early, even before symptoms appear. Early intervention can prevent serious complications and improve outcomes. Your doctor may recommend regular liver function tests based on your health history and risk factors. Vitamin D is important for bone health and immune function, but deficiency is common in older adults. A blood test can measure your vitamin D levels. If you're deficient, your doctor may recommend supplements or lifestyle changes to improve your levels. Maintaining adequate vitamin D can help prevent osteoporosis and support overall health. Anemia is more common in older adults and can cause fatigue, weakness, and other symptoms. Blood tests can check your hemoglobin and iron levels. Early detection allows for treatment to address the underlying cause, whether it's nutritional deficiency, chronic disease, or another issue. Regular screening helps maintain your energy and overall health. Sexual health remains important at any age. Screening for sexually transmitted infections, STIs, may be recommended based on your risk factors and sexual activity. Tests can detect infections like HIV, syphilis, and others, often before symptoms appear. Early detection and treatment can prevent complications and protect your health. Don't hesitate to discuss sexual health with your doctor. Obesity increases the risk of many chronic diseases, including diabetes, heart disease, and certain cancers. Your doctor will monitor your weight, body mass index, BMI, and waist circumference during regular checkups. Early identification of weight issues allows for lifestyle interventions that can improve your health and reduce disease risk. Maintaining a healthy weight is key to aging well. Alcohol use can affect your health in many ways, especially as you age. Screening for unhealthy alcohol use involves simple questions during your checkup. Early identification of risky drinking patterns allows for counseling and support to reduce harm. Moderating alcohol intake can help prevent liver disease, falls, and other complications. Tobacco use remains a leading cause of preventable disease. Your doctor will ask about your smoking history and provide support for quitting if needed. Screening for tobacco use is an important step in preventing heart disease, cancer, and lung disease. Quitting smoking at any age improves your health and quality of life. Falls are a major concern for older adults and can lead to serious injuries. Your doctor may assess your risk by asking about previous falls, balance, and mobility. They may recommend exercises, home safety modifications, or physical therapy to reduce your risk. Preventing falls is crucial for maintaining independence and quality of life in your 60s. Sleep apnea is common in older adults and can affect your energy, mood, and heart health. Screening involves questions about snoring, daytime sleepiness, and sleep quality. If you're at risk, your doctor may recommend a sleep study. Treating sleep apnea can improve your overall health and reduce the risk of complications like high blood pressure and heart disease. Glaucoma screening is especially important in your 60s, as the risk increases with age. Your eye doctor will measure your eye pressure and examine your optic nerve during routine eye exams. Early detection and treatment can help prevent vision loss and maintain your independence. Don't skip your regular eye appointments. If you have hearing loss, a hearing aid evaluation can help determine the best device for your needs. Modern hearing aids are discreet and effective, improving communication and quality of life. Your audiologist will assess your hearing and recommend options tailored to your lifestyle. Don't let hearing loss limit your activities. Seek help if you need it. Depression screening is a vital part of your health checkup in your 60s. Your doctor may use questionnaires or conversations to assess your mood and mental health. Early identification and treatment of depression can improve your outlook, energy, and relationships. Mental health is just as important as physical health, so don't hesitate to discuss any concerns. Dementia screening helps identify early signs of cognitive decline. Your doctor may use memory tests or ask about changes in thinking and daily function. Early detection allows for planning, support, and interventions that can help maintain independence. If you or your family notice changes, bring them up at your next appointment. Osteoporosis screening is crucial for both men and women in their 60s. A bone density test can detect bone loss before fractures occur. Early detection allows for treatment to strengthen bones and reduce fracture risk. Maintaining bone health is key to staying active and independent as you age. Atrial fibrillation, AFib, is a common heart rhythm problem in older adults. Screening may involve checking your pulse or using an electrocardiogram, ECG. Early detection allows for treatment to prevent stroke and other complications. If you have palpitations or irregular heartbeat, mention it to your doctor. Glucose intolerance is a precursor to diabetes and becomes more common with age. Screening involves blood tests to measure fasting glucose, or A1C. Early detection allows for lifestyle changes to prevent progression to diabetes. Maintaining healthy blood sugar levels supports overall health and reduces the risk of complications. Thyroid disorders can affect energy, weight, and mood. Screening involves a blood test to check thyroid hormone levels. Early detection allows for treatment to restore balance and improve symptoms. If you experience unexplained changes in weight, energy, or mood, discuss thyroid screening with your doctor. To sum up, your 60s are a critical time to stay on top of your health with regular screening tests. From cancer screenings to heart health, vision, hearing, and mental health, these tests help catch problems early and keep you feeling your best. Work with your healthcare team to create a personalized screening schedule that fits your needs. Staying proactive now sets the foundation for a healthier future. Your health is your most valuable asset, especially as you enter your 60s. By staying informed about recommended screening tests and following through with regular checkups, you can detect issues early and take steps to address them. Remember, prevention is always better than cure. Make your health a priority and enjoy the benefits of an active, fulfilling life in your 60s and beyond.